Hello, everyone, and welcome to this week's Product School webinar. Thank you so much for joining us today. So just in case you didn't know, Product School offers product management certificates online and at our 20 campuses worldwide. On top of that, every week we have some amazing local product management events and hosts online webinars, live streams, and Ask Me Anything sessions. So if you're interested, head on over to productschool.com after this webinar to check them all out. So today we have an awesome guest presenting with us. I'd like to introduce you to Valentin Klein. Valentin Klein is a practical doer that focuses on getting the job done regardless of the situation. He has worked internationally in challenging environments, and he is currently holding the position of product manager at KRY. Valentin is a product manager based in Berlin who is leading product growth efforts for the German market at KRY, a telemedicine app that lets you skip the waiting room and get medical advice from a doctor in minutes using your phone or tablet. His strong organizational and motivational skills enable him to lead cross-functional teams from engineering, QA, design, and BI. So feel free to leave any questions that you have for Valentin in the comments, and we'll address them at the end. And without further ado, let's go ahead and welcome Valentin. Thank you so much for joining us today.
Hello, everyone. Thanks, Nikki, for the introduction. And thanks, Product School, for giving me the opportunity to talk today. I'll go ahead and share my screen. Do you see my screen?
Yep, I see it.
Great. So yeah, I'm a product manager at KRY, a Swedish telemedicine company. And I'm here today to talk about my learnings on how to build digital healthcare products. So yeah, on today's agenda, I'm just going to talk briefly about my journey, how I got there, and then I will jump into like what we should consider as PMs when building digital healthcare products. And then I will talk about what we should know about our stakeholders and who are our stakeholders in this industry. And then I'm just going to give my thought on an extended version of the cross-functional team. So just to briefly give an intro, I'm originally from France. I graduated from a bachelor in international business in Strasbourg. I then moved to Berlin, where I joined Optimize. It's a SaaS platform that enables you to run direct mail like you run email marketing. I had the chance to be the first employee there and work closely with the founders. So that's actually kind of like how I got into product management and just like give inputs on the product and start to design and build the product with the founders. I then moved to Ada Health, and that was actually my first experience in digital healthcare. So Ada, for those that don't know Ada, it's an AI-powered health platform helping millions of people around the world to first understand their health, but also like help them navigate to the right care. Basically in Ada, you have a symptom assessment and you enter a symptom and you might have to answer like 20-ish questions to then get the top 5 conditions that you might have. And from there, you can get recommendations. At Ada, I was leading the core cross-functional team that was working on the mobile application. And then later this year, I moved to KRY. So KRY is actually a telemedicine company based in Sweden. And we offer users the possibility to skip the waiting room, sorry, and have a consultation from anywhere they want. And KRY is actually the most downloaded doctor app in Europe. And this summer, we actually achieved a huge milestone, which is we helped more than 1 million patients across 4 countries, Sweden, Norway, UK, and France, and we're soon launching in Germany. So as you might know, the regulations in all countries over Europe are starting to loosen up and make it possible for us to provide care to more people in Europe. With KRY, the main thing is that instead of like going to the doctor's office, you can get your prescription through a digital consultation, and you can get it delivered at home or go to the local pharmacy of your choice. You can also get like sick notes and referrals to specialists. So just like before I start, I just like want to put a bit of context here and talk about the digital health market. So I don't know like how many people are from this market in the audience or from this industry in the audience. So if you are, like, just please let me know. Or if you're like looking to move towards that industry, also let me know. I'd be interested. So just a bit of a data here. In 2017, there were already like 325,000 health apps on the market. And every week there were like 200 more apps that were released. So this is a sign that this market is more, that healthcare is more and more accessible. It's accessed everywhere, and people are being more and more conscious about it. And people, like, since ever are already like using like digital services to seek health information or help in general. And mainly it was done by Google. As some of you might know, 5% of Google searches are being like health related. So there's a lot of like new apps and new digital health apps that are actually more specialized and hopefully will replace these Google searches. But this means that we are all fighting or competing against Google on the market. So as I said, the competition is fierce on that market. And that means that nearly half of the app downloads are actually just driven by 41 apps in the market. And these apps have like more than 10 million downloads. And only 2% of these apps have like 500,000 downloads. So I want to say, if you're building a digital healthcare products, you want to be in those 2%. And actually, this is like mainly due to the lack of guidance from healthcare providers. These apps are like offering an overwhelming number of options for users, which is hard for users to navigate on their own. And usually just go to like the default app, the one that's like the most famous, the most popular one. So I'd say you have to work with the market to really like make your app stand out. And we see like a really like low adoption for some of these apps. So we might ask ourselves like, just why? And since this is like hyper competitive markets, it's important to build product that user will love and trust. Too often, businesses are funding technology rather than solution. So they will invest heavily in the latest tech to have some AI here and some AI there. But in the end, they will like miss the main goal, which is like understand the needs of the user, the pain of the users, but also understand the system they're working on or working in. And one of the beliefs that we have at KRY is that we put the patient first. And this is what I think one of the most important value we have that help us like build better healthcare products. So I just mentioned that the digital health business are complex, and some of them like don't fully understand the system they're working in. And that's like maybe because like there's like strict and complex regulations, and it's often seen as a limitation, when I actually think this could be an opportunity for majority of us, because we need to work with the people that are regulating the markets to build like patient first products. This was actually the case for KRY in Sweden, where they started. Telemedicine was not a thing, it was not legal, it was not recognized, and they had to like find their way with local authorities to make telemedicine recognized by some like by some departments in the country. And this like took some time to grow, but then it became like a national it became like nationally available. if we ask ourselves, what should we consider as PM when we build these products? I'd say the first thing is we need to be patient first. As I mentioned before, we need to make sure we build products that user love and trust. And to do that, we need to put the user at the heart of the processes, and we need to design for the users, and not necessarily for the fancy tech. You can have the fancy tech, but like make sure to solve the problems first. And that means that we should understand the fear of our users, because I honestly think that health topics are scary for most people, and it's even like taboo or even sensitive for them. So we need to make sure we build products where users feel safe, that they feel that we care about their well-being, that we care about their rights and the data as well. And since healthcare is also like sometimes just like super complex, like the wording they're using is also like maybe scientific, or just like the normal lambda person might not know all these words. We need to find ways to decomplexify these situations for our users and explain them the hard things in a simple way. I then think we should pay a closer look to our first-time users. And this is a bit more like a digital health topic, because in other markets that are a bit more mature, first-time users already know how to use these products. While in healthcare, usually you're bringing a product that's like disrupting an industry, a system, or like something completely like you're bringing something completely new to the market. And when you do this, users might just not understand the benefit. They might not understand why they should use this application. They might not understand their rights, or they might not understand like if it is like a legit product to use or not. So you'll have to educate people and guide them and reassure them along the way to make sure you're providing the right level of care. And for example, like people were not used to have a doctor in their phone, or for like video. So there's a lot of like education that needs to happen on that level for people that are not used to that. And you also might want to like work with like local authorities and partner to guide first-time users. As we just saw before, people don't know about these apps and they just go for like the default apps. That's because they're not like marketed and they're not promoted correctly. They don't have the right certifications, things like that. That's just going to bring trust and value to the larger audience. I then think we should like personalize the product experience as much as we can. So if we know something about the user, we should use it to personalize the experience. I'm pretty sure like everyone will like kind of like this kind of like attention. So if we look at these examples, for example, you can use simply use like the name of the user to personalize the experience and make it feel more personal. Or you can even like understand the gender of the user or the situation of the user, and then recommend that user some symptoms that are related to his gender or his situation. For example, that on the second screen, that user is a male that has a child. Or you might even like understand like at what time of the year the user is using your app, and recommend offerings or like anything that is linked to that time of the year. So now if we look at like the stakeholders, I think we can clearly define like 4 main stakeholders that are not the ones inside of your company. So you have the patient. I think I've already said that the patient needs to be at the heart of our decisions. And too many products are built just for the tech and for the awesome AI. And yeah, it's a great way to raise money, but that's not everything. I don't think if your product is using doctors or affecting doctors, clinicians, then you should consider as well the clinicians, because these are like experts in a way, right? The patients are going to use your product a few times and they're really new. When you're building for clinicians, you are bidding for expert users, and these users are going to use this product every day. This is going to be like their working tool. So think about like the clinicians and how many tools they have right now. There's an overwhelming number of tools out there. So the best would be like to kind of like unify all these tools to have like it's like seamless flows. Of course, this is like easier said than done. But if we look into the future, I would expect like a few strategic mergers or acquisitions of tools to like that would like complement each other to build like these seamless flow for clinicians. And then I think like every company needs some sort of like business model. So I think you should spend like some time understanding the maturity of the market and trying to understand like how you can enter that market, how can you disrupt it, and how this market is currently being financed, right? So maybe you should ask yourself who will actually pay for that product, how much are people willing to pay, and so if the market is mature enough, you might have the chance to work with like local authorities and they already have an interest maybe in digital health. So there's maybe like a reimbursement scheme that is available for you to leverage, and basically you get paid that way. And that's like I'd say a scalable way to build your product. However, if that's not the case, then you might have to like find alternatives, like build like partnerships or go for like more like a private model until the market like unlocks itself. And last, I want to talk about like regulations. It's a complex topic and I'm definitely not an expert, but I believe that as PMs, we need to be aware of like what's going on in the market and how dynamic that market is and how it's opening up. So I know that digital health is like somehow new to a lot of people. When I say people, I mean like, of course, like users, but also like authorities, government, regulators, everyone. The second we're like disrupting this industry, everybody needs to readjust. So in Europe, we see like a lot of like countries that start to open up more and more, and we see these changes in the regulation. So for example, in Germany is the world's second largest healthcare market after the United States, spending around like 374 billion euro annually. So this is huge. But however, this is like still like until recently, it was one of the lowest digitalized country among the developed countries. And actually, I just went to the doctor today, and I told my doctor I'm working for KRY, a telemedicine company. She was interested, and then she laughed at me because she just said that in Germany we're just like so far behind in terms of like digital tools for or in healthcare in general. So here are just like a few key dates. Last year, telemedicine became like public and legal for privately insured people. In August this year, publicly people were able to like claim reimbursement for telemedicine. And just like earlier in November, they removed the ban for next year to advertise telemedicine and allow clinicians to prescribe digital health apps to patients. And this is actually the first time ever in history that this is possible. And when we look at 2020, we're going to go more like towards the e-prescription system in Germany, and the year after more towards like a health record on a national level. So now I just want to talk briefly about like the importance of cross-functional teams in our industry, and this is maybe how we look at the cross-functional team in most of the industries, which is good, but I think we need to extend this cross-functional team in digital healthcare. Because most of the decisions we are going to take on an everyday basis will imply some regulation, some data exchange, or just like some medical safety, and we need to involve these the medical director or lawyers or data experts into our processes as early as possible to make sure we're building compliant and safe product for our users. And just like a little anecdote on that, at Ada, I actually ended up being in the same room as lawyers, just because we had like issues with the office space, and it actually turned out to be really beneficial for me to just like go and ask to the lawyers if we could do this, if we could do that. And this is actually, at that point, I realized the importance of having a lawyer really close to the cross-functional teams. Great. Actually, that's it for today. Thank you very much for listening to me. And if you have any questions, please feel free to comment in the Facebook link, or just add me on LinkedIn and ask me your questions later. Thank you.
All right, thanks, Valentin, for that. That was awesome. So yeah, we do have a couple of questions. So we really like to ask all of our PMs this because it kind of varies depending on what field you're in. So we'd love to ask you, what would you do in your first 30 days as a PM?
Yeah, first 30 days as a PM, I think I would really try to understand the organization I'm working in, and understand the maturity of the organization. So do you have the key people? Like, what is the status of the team? I started this new job and I was the only PM. I mean, I had no designers, I had no engineers, there was nothing. So hire your team if you don't have a team, and make sure that you are like covering all the legal topics, things like that, before you actually even start to build your product. It really depends, like actually, if you're like joining a team and you have to build a product from scratch, or if you're building a team with an existing product, this is also gonna vary. Okay,
great. And how did you start the process of reaching out to customers and building relationships with them?
Yes, so as I mentioned in my presentation, design for the users is a key thing. And at KRY, we actually have more designers than we have product managers. And the reason why is because we need to have user researchers that work cross teams, and they really like focus on understanding the needs and the pain points of the user. So for example, like before launching in Germany, we actually did some research, for example, with like clinicians, like understanding how they would use this tool in Germany, because it's like they have different habits, they have different like ways of working. So you really need to just like sit with the people in the same room, put in front of the people like a prototype, and ask questions.
Great, that's great advice. And then for the final question of the night, do you have any final advice that you'd like to give to someone who's aspiring to be a PM like yourself?
Yeah, I think like breaking into digital healthcare is it's a great opportunity for you in the future, because it's just the market that is just starting. So the earliest you get into like digital healthcare right now, the brighter your future is going to be in product management, and you're going to be able to help like a lot more people in the future. How can you do that? I think there are several ways. Either you have previous product management experience, or you try to join a healthcare company and work in a different department first, maybe in the marketing department, then transition to product, or in the customer support side, things like that, to really understand the needs. And then you're able to transition. And also this will just like bring you credibility in your day-to-day job if you have some healthcare experience.
All right, well, thank you so much for that great presentation and for answering our questions. So that's all we have for today. Thank you everyone who joined us watching on Facebook. And before we leave, remember that we do offer weekly online and on-site events in more than 100 cities. You can find us on social media at Product School across all platforms. And be sure to keep up with the latest product management content at our blog, which is at productschool.com/blog. Thank you all so much for joining us. Thank you so much, Valentin, again. I hope you guys enjoy the rest of your day, and I'll see you next week for the webinar. Thank you.